Hello, everyone, and welcome to the AHS CEO's blog. My name is Mauro Kies, and I'm Vice President of Clinical Support Services and Cancer Care Alberta. I'm filling in for our CEO, Dr. Verna Yu, who's off this week, taking a very well-deserved break and also enjoying her first grandchild. One of my roles in overseeing clinical support services is serving as the board chair of Alberta Precision Laboratories. They are our provincial lab that has overseen Alberta's COVID-19 testing program for the last year and a half. And Alberta has truly been a leader, along with APL, when it comes to COVID testing. And I felt this week's vlog was a great opportunity to talk about the success of our testing program and learn about some of the innovative things APL has been doing to provide testing across the province as the pandemic has evolved. Joining me today, there are three members of APL's medical scientific team who led the development of COVID testing program. We have Dr. Carolyn O'Hara. She is APL's interim chief medical laboratory officer who oversees the COVID-19 testing program. Dr. Nathan Zelius, a medical microbiologist with the Provincial Public Health Lab, who's been involved in the genetic testing and surveillance for various strains of virus that cause COVID-19. And Dr. Will Stokes, a medical microbiologist and infectious disease expert who has led the rapid point of care testing program for COVID-19. I want to thank you all for taking the time to come and talk this morning about the excellent work you and your teams have been doing since the beginning of the pandemic. So Carolyn, we're going to start with you. Can you tell us about how Alberta's COVID testing program began and why it's considered one of the best in Canada, if not the world?
Sure, and thanks for having us, Mauro. I would be remiss before I answer your question if I didn't acknowledge a key member of our team who isn't with us today. But he is on a well-deserved vacation. So that's Dr. Graham Tipples. He's the medical scientific director of our APL Public Health Labs, and I'm standing in for him today. So how our testing program began, Dr. Tipples and his team were watching things very closely early on in the pandemic. And in fact, our research teams and our public health labs were already working on lab-developed tests to be able to detect COVID even before the first case was seen in Alberta. One of the big challenges we had early on in the pandemic was global supply chain challenges for lab testing equipment were extremely limited. And without our lab tests developed locally, we would not have been able to ramp up testing as quickly as we did. In the early days of the pandemic, we were testing maybe a few hundred samples a day. And at the peak of the pandemic, we were 18 to 20,000 tests a day in a very short period of time. So to me, that was pretty astounding for us to be able to do that, given the challenges that we had getting lab equipment in. And for the early days of the pandemic, we were actually, I believe, one of the leaders, if not the leaders, in per capita testing of COVID in North America. And as Dr. Zelius will talk to you a bit more about later, we were also one of the first provinces to test all of our positive cases for the new variants of concern. Currently, we're doing about 5,000 to 9,000 tests a day, but of course, we're able to ramp up if required. And crossing my fingers that we're fully in wave 4 here, and hopefully we won't need to get up to that 18 to 20,000 tests a day again. But I guess time will tell.
Thanks very much for that, Carolyn, and really appreciate the special shout out to Dr. Graham Tipples as well, who's been instrumental in this approach as well. Carolyn, what else do you think are some of the highlights or key achievements for APL when it comes to COVID testing?
Highlights and key achievements, that's certainly a tough one to answer. I mean, I'm just so very proud of our team, our teams. I guess it really does take a village to get this, our testing program up and running. There's so many, unsung heroes behind the scenes. We were able to quickly hire and train new staff, source much needed equipment, which I mentioned before. We worked with foundations to obtain funding to get high volume instruments online and take the pressures off our staff doing manual techniques for our lab tests. They're getting tired and exhausted, understandably. Work with our academic partners to provide access to samples for much needed research. There's still a lot we don't know about COVID. And really all of this speaks to our APL tagline, Leaders in Laboratory Medicine. And it certainly made me very proud to see a lot of my colleagues, two of whom you'll meet in a little bit, in the media and really promoting lab medicine. I think it really has elevated our profile and really helped us, get people to understand how important the lab sector is, not only for COVID testing, but medicine in general. And thus far, I believe we've done about 4.5 million tests on about 2 million people. So certainly something to be proud of. And although our lab-based testing continues to be the gold standard for COVID, we also brought on rapid point of care testing, with which my colleague will be talking about a little bit. And it's another tool in our toolbox that's been proven to be very valuable through the pandemic response. And finally, just, despite many of our staff being exhausted, people haven't had a lot of time off, we certainly were able to meet any challenge thrown our way. We're still not out of the woods, we're fully in wave 4, I believe anyway. There's still a lot to learn. We're not sure what other new variants are around the corner, but I'm certainly confident that we have the team and expertise to work through any and all future challenges.
Awesome. Thanks very much, Carolyn. Will, we're going to go over to you now. I was hoping that you could tell us more about how the rapid testing is being used in Alberta and some of the fascinating work your group did to incorporate rapid point of care tests into our overall testing program.
Thanks, Mauro. The rapid tests were particularly interesting to set up just based on their novelty and their intended use, which is unique compared to the other lab testing we do. So in late October, early November, we got a shipment of thousands of these tests. And as you can imagine, these tests were brand new to the market. There wasn't as much data out there on how well they work compared to the usual tests we implement in our lab. And whenever we get a new test in the laboratory, we do what's called a verification or validation. And what that means is we test it out on samples to see how well it works before we actually implement it out into on patients. So in this particular case, that was difficult because the tests are designed to be used at the point of care, so right next to the patient. So we couldn't just use the samples that we had in the laboratory like we usually would. We had to actually go out and do the testing right next to the patients. And that, of course, involves getting consent for the patients and basically doing a clinical study. During that time period, the amount of COVID wasn't as high as it was back in phase 2, phase 3. So a lot of the COVID positive patients were outpatients who were isolating at the home. So in order to get any testing to them, we would have to go essentially door to door to their house and do the testing there. And we were able to achieve that thanks to the Mobile Integrated Health Group, who are a group of healthcare professionals who provide community mobile services, such as IV infusions or urgent care to vulnerable populations. They really stepped up and helped us by going door to these recently COVID positive patients who are isolated in their home, and doing the swab collection of those patients and doing the testing right then and there. And that helped us get enough data to say, this is how the test works in this particular population. These are the things we need to think about. This is when the sample stops working as well as it should, et cetera. So that really helped us. And because of that, we cut down the process from getting the test to implementing the test down to about 1 month. Whereas normally I would say something like that would take at least a year. So that was an incredible achievement on our part. And since then, we've implemented it to basically every corner of the province. So every assessment center, we have it in homeless shelters and the different laboratories. And we even do mobile community testing for outbreak settings, as well as screening in schools, universities. Really every corner of the province has these tests now.
Thanks very much for that, Will. And lastly, we're going to see how important it is to monitor how the virus is evolving as new strains continue to emerge that infect people in different ways and may impact the effectiveness of our vaccines. Nathan, over to you now. Can you explain what our approach has been to tracking the variants of concern and other strains over the last year and a half?
For sure. Thanks, Mauro. Yeah. Even in the really early days, since the beginning of the pandemic, really, the lab had a strategy for doing genetic sequencing for new mutations arising in the population or arriving from outside the province. And so that allowed us to initially identify one of the first cases of variants of concern in Canada last Christmas, when we detected that first case of B117 or alpha in Alberta. And so initially we were doing whole genome sequencing, and that allows us, it gives us a lot of rich information about the virus. It's a fairly laborious, time-consuming methodology, but it tells us exactly what lineage or strain of COVID-19 is infecting somebody. But when variants of concern became a concern and began spreading more globally in early 2021, we wanted to develop a faster methodology to identify them quickly. So the Public Health Lab developed some in-house PCR tests in order to quickly screen COVID-19 positive samples. And that's really given us a very strong surveillance program for variants in our population. And at the time, it almost felt like a pandemic within a pandemic to a certain extent, because back in early 2020, we were faced, as Dr. O'Hara discussed, we were faced with this need to quickly develop a lab-developed test to detect COVID-19 in infected patients. And then we faced a similar challenge where there were no tests commercially available for variants. And so the research team at the Public Health Lab had to once again come up with some new, completely different lab-developed tests to quickly detect these variants of concern. So they basically designed new tests to find those genetic differences in COVID positive samples, to identify those different strains, and then we had to evaluate those tests and then implement them pretty quickly. So starting in February of 2021, we were actually able to ramp up our variant testing to basically do testing on all COVID-19 positive samples that were detected by a lab in Alberta. And so those variant tests are a lot faster than doing that whole genome sequencing that we were relying exclusively on at the beginning of the pandemic. But of course, they don't provide as rich information about the strain as whole genome sequencing, which tells you basically any mutation that could be in the virus. So those variant PCR tests that we do at the Public Health Lab detect a number of different mutations in the virus's spike gene. But taken together, we're able to use that information about which mutations are detected to differentiate variants of concern from each other and non-variant or wild type strains. It's important for us to continue to do that monitoring and do that variant testing, just for us to understand that local molecular epidemiology, basically what strains are circulating in Alberta, because we do want to be able to catch new introductions of new variants coming into the province. We want to detect newly emerging variants that might have biological significance. And it's also helpful in understanding whether or not in real time, if variants are showing increased transmission dynamics, or if there's reduced vaccine effectiveness for specific variants. It's also important for infection prevention and control processes. So that's kind of a summary, I think. We still do whole genome sequencing on a number of different subsets of populations to get that more rich information to determine lineages. But that's only for a subset where we do the variant screening for all positive cases in Alberta.
Thanks very much, Nathan. And with the Delta variant accounting for the vast majority of our cases now, are we still continuing to screen all positive cases for variants?
We are, yeah. So we do continue to screen all positive samples for variants of concern, and we're still doing that full genome sequencing on targeted populations. Delta is definitely taking over in terms of the numbers of positives that we're seeing that are Delta. Almost all of our positives that we're seeing now are Delta. But we're constantly on the lookout for any new variants of concern that are popping up in different parts of either the country or elsewhere in the world that we might want to incorporate into our variant screening strategy.
Thank you very much, Nathan, for that in-depth summary. It's been impressive to see how quickly our teams from APL, Public Health, and another of our disciplines around AHS have come together to respond to the pandemic. I know it's been an incredibly stressful and challenging time for all healthcare workers, and I want to say thank you to everyone for the hard work, dedication, and professionalism that you guys have shown in doing what is necessary to protect the health of Albertans. I also want to do a special shout out to APL on this triple threat approach when it comes to testing, the rapid testing, and the variant analysis that has been able to help us manage this pandemic. With most people being vaccinated, COVID testing may not play a larger role as it did earlier in the pandemic, but continues to play an important role in the monitoring of how it's evolving and spreading in our community. Thank you, Carol and Will and Nathan, for joining me today. Keep up the great work. Stay safe, everyone. Thanks for watching, and get vaccinated.
Together, we do amazing things every day.